So, most people who go through a traumatic event eventually get better with time and with self care. But sometimes these scary experiences can lead to something called post traumatic stress disorder or PTSD. But what is PTSD exactly? Hi, I'm Michelle Young, LCSW with Mental.Health.Merienda.
And I'm Dr. Adeline Leon, licensed clinical psychologist. So PTSD, it's a mental health condition. It's triggered by a terrifying event, either experiencing it or even witnessing it. In symptoms, you could see flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. If the symptoms get worse, if they last for months or even years, and if they interfere with day-to-day functioning, which that's something you'll hear us say in these videos about mental health conditions, it has to interfere with your functioning, then you might have PTSD.
So, PTSD symptoms can start within a month of the traumatic event or even years after. And these symptoms can cause significant problems in your day to day, just like you're saying, Adeline. So, problems in your work, problems in your social functioning, the way you interact with people and your relationships. So, again, really, it's about interfering with your day to day functioning. So, there are four types of PTSD symptoms that we're going to talk about. So, those four are intrusive memories, avoidance, negative changes in your thinking and mood, and changes in physical and emotional reactions.
So the first one is intrusive memories. These are recurrent, unwanted, and distressing memories of the traumatic event and reliving the event as if it were happening again. So kind of like flashbacks, like what we see in movies with veterans, nightmares about the traumatic event. Those are really, really common in PTSD.
And then another symptom is something we call avoidance. So trying to avoid thinking about it, talking about it, and by it, I mean the traumatic event. That could also include avoiding certain places, activities, or people, anything that's going to remind you of that trauma, you try to avoid. And sometimes that can really impact your functioning. So if something happened on the way to work, like in the community, and you're avoiding now going into the community, that you can see how that could be really impactful of your day-to-day functioning.
And then there's negative changes in thinking and mood. And this one is a little bit harder to describe, but it's negative thoughts about yourself, about the world, about other people, feeling detached from people who you're even very, very close to. So even your family, close friends, difficulty experiencing positive emotions, feeling emotionally numb. And this might kind of sound like depression, but it's different from depression. It's not like necessarily just that sadness, it's that emotional numbness. And so definitely that's one other thing to watch out for in PTSD.
It's almost like that traumatic event really like changes your outlook on life. Would you say?
Yeah, it like when I've spoken to patients with PTSD, the way they describe it is that it's definitely changes your outlook. You have this kind of cloud over you because this traumatic event is impacting you day to day, and it almost affects your ability to even feel positive emotions. Like it interferes with your ability to feel that closeness with other people, to feel those positive emotions. And this part especially, I think, can be really, really distressing.
Yeah, I think we probably see a lot of people with PTSD self-isolate because it's just so hard to connect.
Mm-hmm.
And then kind of related to that, the last symptom that we'll talk about are changes in physical and emotional reactions. So we'll call it arousal symptoms. So some examples of what that could look like, being very easily startled, easily frightened, being very hypervigilant, we'll call it hypervigilance. And what that means is that you're on guard, like you're almost like anticipating danger. And that could also lead to things like trouble sleeping, trouble concentrating, being just really irritable and on edge, and then having anger outbursts or having aggressive behavior. Because again, like you're on edge, you're feeling really irritable. So little things could probably get to you or trigger you to get more angry than you normally would. And then also another one is overwhelming guilt and shame. So it's almost like, I guess one way you can think of it is like your body remembers that traumatic event. And that's what we're seeing is that hypervigilance, that easily startled, that fearfulness in your body. It's like your body still remembers that trauma.
Yeah, when I've seen patients with PTSD, definitely the hypervigilance really impacts them. I remember someone who had a lot of trouble sleeping, and it was because when he was in the military, they would get bombed in the middle of the night, and so that you really couldn't. just sleep deeply because you were risking your physical well-being, you're risking your life. And so he just remained this really light sleeper, even though once he was back home, that danger still wasn't there. But just like you said, Michelle, it's like his body still remembered that trauma and that experience, and it couldn't stop doing that.
Yeah, yeah. And I think for people who maybe experience like a one-time traumatic event, like sounds could kind of trigger that again, that your body remembers that sound before that negative event happened. And that, does that creates that hypervigilance, that startle response.
And so, some causes and risk factors for PTSD. First thing, which I think we've kind of touched on this already, stressful experiences. So, including not just having a stressful experience, it's the amount and the severity of the trauma. So, was it a repeated trauma? So, I think about like sexual abuse. Was it something that happened over and over again? How severe was it? And how much you went through that in your life?
Yeah. And I think too, when you talk about severity, like life or death, like you thought you were going to die and then you survived it. And that's also what's related to that severity. Another risk factor could also be other mental health conditions. So if you're already someone who is anxious or you struggle with depression, for example, then you might be more prone to having post-traumatic stress disorder.
And having problems with substance misuse, such as drinking too much, drug use, I think what happens with that is that you're numbing your emotions further. And so that's already a symptom that you have in PTSD. And so you're kind of making that worse.
And then another one is lacking a good support system. So again, when you're isolated and you don't have that support system, that also exacerbates mental health symptoms. And it does so with PTSD.
And then having blood relatives with mental health conditions, so anxiety, depression, it doesn't have to necessarily be PTSD, but having a predisposition for anxiety and depression, if you experience something very traumatic, then that could manifest as a PTSD.
And another risk factor would just be your temperament. So inherent features of your personality that also can impact whether you're more prone to getting PTSD versus, someone who doesn't.
And then last one is the way your brain regulates the chemicals and hormones your body releases in response to stress. I think naturally some of us might be, you think about fight or flight response to danger. So some people might already at baseline be more likely to have more of the flight response or more of the fight response. Some people tend to freeze. If you think about, your friends and family and what you know about each other, like, oh yeah, this person tends to kind of freeze when they're just really stressed. This person kind of like it gets into action, and those are just natural differences between us. But some of those differences can make you a bit more likely in some cases to develop PTSD when you've experienced something traumatic.
So tune into our other videos to find out more about PTSD as well as other mental health conditions. Thanks for watching.
Bye.